Welcome to Medical Ambassadors International informational video on coronavirus. In this video, we will share facts about the virus, describe the symptoms, and tell you what you can do to protect yourself from getting the virus. Coronaviruses are not new and are common in both people and animals. Some examples of coronavirus that infects people are MERS and SARS. The disease is called COVID-19 and is caused by the SARS-CoV-2 virus. In the media, it is often referred to as simply coronavirus. We'll talk more about symptoms later, but in general, the symptoms seem like a cold or the flu. While anyone can get the virus, older people, 65 or up, and those under 2, or those with other medical conditions, could experience worse symptoms and worse infections like bronchitis or pneumonia. There are several ways we know that coronavirus can spread from one person to another. Coughing or sneezing is one way. You should always cough into your elbow or your shoulder, not your hand, as this reduces the chances of spreading airborne disease. Coronavirus can also be spread by close personal contact with an infected person, such as shaking hands or other physical contact. Coronaviruses can be spread by touching objects, like tables or tools, that may have the virus on them, and then touching your face with your hands, especially your eyes, nose, or mouth. It is not known how long the virus can live on objects, though it is believed that it may be able to live on objects for hours or days. A disinfectant spray that is applied to the surface of the object can help reduce your risk of infection. Contact with the feces of an infected person and failing to wash your hands with soap and water could cause you to catch the virus. People are the most infectious when they are showing strong symptoms, but there are a few cases of individuals being infected by those who show no symptoms, but this seems to be less common. From the time a person is infected by the virus, it usually takes from 1 to 14 days before they begin to exhibit symptoms of COVID-19. The symptoms of coronavirus include a runny nose. Headaches are another common symptom of the virus. People with coronavirus often cough or sneeze. Coronavirus often causes a painful sore throat. A high fever is another symptom of coronavirus. People with coronavirus often have shortness of breath and a hard time breathing. All of these symptoms combined to create a general feeling of being unwell or being sick. Unfortunately, there is no vaccine that can keep you from becoming infected with the coronavirus. Also, because it is not a bacterial infection, antibiotics have no effect on the virus itself. Scientists are working to develop vaccines as quickly as possible. There are things that you can do to reduce the risk of getting coronavirus. You should not travel, if at all possible, to infected parts of the world. The single greatest thing you can do to protect yourself is to wash your hands thoroughly and regularly. You should always use soap and running water. Here's how to properly wash your hands. First, wet your hands with clean running water. Second, use soap. Wash both the front and the back of your hands as well as between your fingers and under your fingernails. Rub your soapy hands together vigorously for a minimum of 20 seconds. One way to estimate 20 seconds is to twice sing or hum the Happy Birthday song at a moderate speed. After washing your hands for at least 20 seconds, rinse them under clean running water and then dry them with a clean towel or an air dryer until they are completely dry. If soap and clean running water are not available, you can use an alcohol-based hand sanitizer. Squeeze a good amount onto your hands and for a minimum of 20 seconds, rub your hands together, being sure to get it on the front and back of your hands, between your fingers and under your fingernails. The sanitizer needs to be at least 60% alcohol to be effective. After applying the sanitizer, let your hands air dry. You should keep your hands away from your face and avoid touching your mouth, eyes, or nose with hands that have not been washed. If you know someone who is infected or who may be infected with the virus, avoid skin-to-skin contact if at all possible, and wash your hands before and after touching that person with soap and water or an alcohol rub. If you are feeling sick, be sure to drink plenty of fluids. If you are exhibiting symptoms of coronavirus, stay at home so that you don't infect other people. Don't go to work or to school or anywhere else where you could pass the virus on to others. If you are feeling sick, get as much rest as you possibly can in order to help your body fight the infection. Wearing a face mask is not recommended for people who are exhibiting no symptoms. Only those who are sneezing or coughing, or those suspected or confirmed to have coronavirus, or those caring for people who are infected, should wear masks. If you suspect you may have coronavirus, call your doctor, clinic, or hospital and get directions on how to get care. Do not go to the doctor or hospital until you receive instructions, or you may infect others. On behalf of Medical Ambassadors International, thank you for watching this video. The information contained herein was sourced from the World Health Organization and the Centers for Disease Control.